Hello, everyone. My name is Brett Allen. I'm one of the third year medical students at the UNLV Kirk-Kerkorian School of Medicine. And the research I'm going to be presenting is an observational study that we've been working on called Spinal Injury Patterns of Off-Road Motorcycle Crashes with the UNLV Department of Orthopedic Surgery. So to get started, two-wheeled motorcycles are a common cause of traumatic spinal injury. And so that's both including primarily motorcycles and dirt bikes for off-road. But off-road motorcycles are usually used in either recreational or race setting. And so that would be like motocross or desert riding, or just kind of like recreational use or dune riding. And there's a lot of natural obstacles as well as jumps and a lot of terrain, which leads to a high risk of axial load during a crash where riders might be falling off of a jump or falling off an obstacle, especially in that setting, which is different compared to on-road motorcycle injury mechanisms. And the typical safety equipment for off-road motorcycles includes helmet, boots, knee braces, but rarely any sort of spinal protection. So really the goal of the study was to identify specific injury patterns associated with off-road motorcycle crashes, as there's a current lack in most of the literature. And so the way that we conducted this study is we took it was a retrospective chart review analysis from the UMC trauma registry database from 2010 to 2019, using ICD-9 and ICD-10 codes to analyze both for spine mechanism or for spine injury, where there was a bunch of different ICD codes to pull data that was from patients that had a spinal injury. And then that was also cross-referenced with the mechanism E codes in the coding process to determine whether these were from a motorcycle, specifically an off-road motorcycle. And so after we got our original data set, specific injuries were identified by reviewing radiology reports and the specific images. And then injury patterns were analyzed and reported as observational data. And so the big conclusion is that the most common spinal injury from off-road motorcycle crashes were transverse process fractures and compression fractures localized into the thoracic spine, primarily the thoracic and less so the lumbar spine region, and less so the cervical spine region. And so of the patients, they were predominantly male, 67 out of 68, with an average age of 33.7. And then 37 of these patients had injuries to the T-spine, and then 33 had injuries to the lumbar spine. The most common injury was a transverse process fracture, 71, followed by compression fractures. And an outline is done in this table here, where there was also a difference in laterality, where there were 49 left transverse process fractures compared to 22 right transverse process fractures. And these were primarily in the lumbar region, whereas the thoracic region primarily had the majority of compression fractures, 41 out of 49. So aside from the most common types of injuries, there's also different severities as far as spinal injuries. And so the most severe injury morphologies are three-column fracture dislocations, also known as chance fractures, vertebral subluxation, or complete spinal cord transection. And these most often occurred in the thoracic region, 12 out of 15 of the most severe injury morphologies. And so over here, we have a table kind of depicting how many multi-spine traumas there were. These large blue graphs depict how many isolated spine trauma there was. Then otherwise, these color-coded bars represent how many different regions were spanned by the trauma. And then these light blue ones were pan-spine trauma. So that's injuries that included cervical, thoracic, and lumbar spine regions. So the limitations of the study was that it was a small sample size. It was an epidemiological study. It's difficult to assess injury debility and neurologic status from imaging alone. And then this was also a retrospective chart review without any clinical outcomes or data. So it's really hard to tell, like, if somebody had a really severe injury on film, how it may have looked in person. The future direction of this study is to categorize the specific injury patterns for street motorcycles and to potentially change safety riding equipment for motorcycles and to also have a better understanding of the types of injuries from these specific mechanisms. So funding and disclosure statement, this project was self-funded. There's no financial interest of any of the authors. And just to kind of summarize our conclusions, that the most common spinal injuries from off-road motorcycles were a transverse process and compression fractures, primarily in the thoracic region. Thank you.